Today's topic is burns. Severe burns are major threat to life. Around 10 million cases are reported per year in India. First, we have to know the layers of the skin. Epidermis is the outermost layer of the skin. Dermis is just beneath the epidermis. Then comes the hypodermis, that is a deep subcutaneous tissue which is made up of fat connective tissue. Now coming to the classification of degree of burns. First degree burns, it is otherwise called as superficial burns. It involves only the epidermis. There are no blisters, skin will be red in color and painful. Then comes the second degree burns. It involves the epidermis and dermis. There are some blisters and the skin, it will be very painful. Now comes the third degree full thickness burns. It involves the entire dermis and epidermis. The skin will be charred, pale, leathery, and there will be no pain in this condition. Now comes the fourth degree, that involves the epidermis, dermis, as well as bone, fat or muscle. Now we will see how to calculate the percentage of burns. To calculate the percentage of burns, we have to know about the rule of 9, which divides the body into segments that are approximately 9% or multiples of 9%, with the perineum forming the remaining 1%. More precise method uses the Lunn-Browder burn diagram. This allows an accurate age-adjusted determination of burn size. There is another easy method. Just check the area of back of child's hand, that is approximately equal to the 1% of the total body surface area. Now we will discuss about the treatment of burns. The basic first aid of the burn is do not keep any ice over the burn area. And most important thing is you have to continuously wash the burn area under the tap water for 20 minutes. When the patient reaches the hospital, provide appropriate analgesics before the burn care. IV opioids are indicated, maybe in larger doses are required. Clean the burn area with water or NS. Debride the wound if needed. Apply topical antimicrobial. 1% silver sulfadiazine cream with the lignocaine ointment you can apply. Note: you should not apply silver sulfadiazine on face because it can cause severe scarring. Triple antibiotic ointment can be used like neomycin, polymyxin B, bacitracin. It plays an important role in reducing the bacterial colonization and enhancing the rate of healing. Use of synthetic occlusive dressings are recommended. Dressing should ideally be changed twice daily. Gently remove the residual ointment as long as the wound continues to weep. Then it stops, you can dress it daily. In minor burns, encourage the victim to take water as much as possible. Injection TT 0.5 ml IM stat should be given to all burns victims. For second degree and third degree burns, fluids are the next main treatment. We have to put 2 large IV bore cannulas as early as possible. The accepted formula is Parkland formula, 3 into weight into percentage of the burns for children and 2 into weight into percentage of the burn for adults. This is the latest ATLS guidelines. For example, a patient who have a 30% of burns and who is 60 kg, 60 into 2 into 30, that is 3600. In that, 1800 ml should be given in the first 8 hours, the remaining over the next 16 hours. Another formula for calculating fluid is Muir-Barclay formula. It is mainly for colloid use. The formula is weight into percent of the burn into 0.5, that is equal to 1 ratio. So first 12 hours you have to give 3 ratio. Next 12 hours you have to give 2 ratio. For example, for a patient who have a 60 kg and 30% burns, approximately 60 into 30 divided by 2. That is 900 ml to be given every 4th hourly for 3 times and 6th hourly for 2 times. So most important thing about the formulas are you have to maintain an urine output of 0.5 to 1 ml per kg per hour for adults and for pediatrics 1 to 2 ml per kg per hour. That is the most important goal of resuscitation. If there is any evidence of airway compromise with swelling of the neck or there is a circumferential burns over the neck, suspected inhalation injury, burns inside the mouth or any wheezing, perform early endotracheal intubation. If inhalation injury is suspected, check the carboxyhemoglobin of the patient and do bronchoscopy at the earliest. If there is a circumferential deep burn, always look for compartment syndrome. It can compromise the distal circulation or it can compress the nerves or prevent the patient from breathing. In such cases, you have to consider a sclerotomy at the earliest to save the patient life. Now we'll discuss about the complication of burns: DIC, inhalation injury, ARDS, renal failure. Infection and sepsis are the very common complication and it is very deadly. To conclude, I'll tell about the mortality rate. The percentage of chance of the mortality, there is a formula to calculate age plus percentage of the burns. For example, a patient who is 80 years old and who have a 20% burns, the chance of mortality is 100%.